Hi friends, welcome back to another video of our neuroscience, and in today's neuroscience we are going to start a new topic, which is the cranial nerves. What are the cranial nerves? Firstly, we will learn about the cranial nerves, okay? So let's start with it. What are the cranial cranial nerves? The cranial nerves are made it with soft and tight tight muscles. They also are a type of muscles which are located in our so many organs, and in our body there are so many organs, so they are presented in that, okay, for movement. They are for movement. Why they have presented in their in that all areas? Because the cranial nerves are smooth, and they move smooth, and they works for thousand lives. Means the cranial nerves uh, doesn't get uh, doesn't makes the organs of our organs feels tired, or makes sensational pains. The cranial nerves always makes our organs feeling healthy. But if the status will be not good of our organs, then we can feel the pains. For making this all movements, the cranial nerves are used because they are smooth and tight and soft. Okay, so on how many types of in how many organs they are presented, and how many types of cranial nerves are there? So we are going to learn how many types of cranial nerves are there. There are so many types of cranial nerves. First one, they are also presented in they are also presented in our smelling, visioning, eye movement, pupil control, eye movement, and face sensation, chewing, taste, facial muscle, hearing, balance, digestion, heart, speech, for saying, for mouth movement and tongue movement, head movement. They all in this all they are presented. So let's learn one by one, okay? So first one is olfactory nerve, which is the cranial nerve, okay, which is a cranial nerve. Then second one is optic. Then third one is oculometer. Then fourth one is trochlear. Then fifth one is trigeminal trigeminal, okay. Then sixth one is abduciminal, okay. Now seventh one is facial and eighth one is vestibulocular bulocular bulocular. We have to pronounce this like vestibulocochlear vestibulocochlear. This is presented for the hearing and balance. And then next one will be the gloss, which will be the glossopharyngeal. And then vagus, then accessories, then hypogloss hypoglossal. So these are the nerves of the cranial, and we are going to learn each of the nerve what they do. First one is olfactory nerve, which is presented in our nose, and it uses for the smelling. Means we used to smell it uses for the smelling things. And the smell which we used to smell, the that nerves is olfactory. Then comes optic, which is the vision. vision nerve, which is used for the vision, which we means we which we see in real life. That is use of that we cause of see which uh, cause of optic nerves. We see the things and around us and the peoples around us, the subjects around us, non-living thing, living thing around us. Okay, now oculomotory. Now you have noticed that also our eye moves smooth when we used to move it. Okay, so oculomotory, that is called as oculomotor nerves. The oculomotor nerves presented in our eye backside, and it makes us eye movement to smooth, and it controls our pupil, means the black particle which is presented in our eyes, it controls it. After that, comes trochlear nerve, which is the eye movement. Also, it also used for eye movement, and abducens, which is also used for eye movement. This all why this thing after for the eye movement, because the eye movement needs so much means like you see up, down, rightwards, leftwards, like this. So you can see rightwards clear and upwards, downwards clearly. For that, they are three nerves: trochlear nerves, abducens nerves, oculomotor nerves. Now the facial facial for facial means the face and the neck part, which is controlled by the cranial nerves, which is facial nerve, which make us taste feel better, and taste us, which used to taste of the food, which you used to taste. Yeah, so it is used for facial. Like you can see here, it is the tongue presented in my mouth. The tongue moves through the facial nerves. Facial nerves makes tongue to move smoothly, like this. Okay, so they use in facial muscles and face taste for the taste. Now the vestibulocular, which is the hearing, for which is used for hearing and balancing. And well, after that, glossopharyngeal means the nerves which is used for taste and swallowing, means when you swallow a food, it goes smooth and softly. You doesn't get any pain, or doesn't get stuck, because the glossopharyngeal, which is very glossy and very soft, which makes the food swallow easily. Then comes vagus. Vagus is used in heart and digestion and speech. When we used to tell again and again, vagus help us, and our mouth movement get more smooth through to the vagus, and heart movement and digestion. Digestion means which are the large intestine. They are having vagus nerves, which makes the digestion more smooth. Okay, like glossopharyngeal. After the glossopharyngeal are presented here. After the glossopharyngeal, the large intestine has vagus, and after that we has accessory, which is used in head movement, which is only enabled for forwards, rightwards, leftwards, upwards, downwards, which is accessory. And then hypoglossal. Hypoglossal is used for tongue movement again. It uses tongue movement more. It makes our tongue movement more smooth. Okay, so it also has in tongue movement, like this. So this was the nerves which was presented in our body. There are 12 cranial nerves, and which has every nerves makes our organs feel better and moving better, and our health better. Okay, so these are the nerves which relay signals, and the brain, between the brain and the sense organs or muscles. They enables an essential activities like seeing, tasting, breathing, heart beating. Some like vagus nerve extend to the chest and abdomen for autonomic control. Doctor test them to diagnose the neurological issues, and they the the doctors test them to the diagnose and neurological issues. Okay, so now we are going to do a case study of the cranial nerves, which is a case study of an 46-year-old woman which was suffering the severe head trauma in a motor vehicle collision. Means when the motor vehicle collides between this woman, and he was suffering head trauma, which is severe condition, and present it was presented in right sided, which is lateral gaze palsy, which is the layer of our head which is presented up here in the right side. And after 1 month later, in it his her initial CT, means Glasgow coma scale showed 14 due to his confusion, and because the confusion in mouth, for seeing confusion, mouth confusion, hearing confusion, speeching confusion, walking confusion, Glasgow coma scale rate was 14 due to his confusion. So of and her MRI was 3D T2 imaging revealed due evolution of the right abducens nerves in porpotine, means of the abducens nerves which are presented in her right, they were very porpotine and crystal up. Then diagnosis come out after that, the patient has to be taken the clinical findings and isolated right in the CNVI palsy. After that they have combined the confirm then combined and confirmed that the traumatic evolution rather it has happening rather than stretch or compression. Means stretch means the skin is getting stretched by the collision, or getting compressed means getting compressed in some layers. Okay, in layers of our brain, in our layers of our head. So I hope you understand what are the cranial nerves and how many nerves are there, and how the nerves has their own ability to make the organs move better and feel better. So thanks for watching my video. Bye bye.